Hey guys. Well, I wanted to just kind of throw out some thoughts and ideas about autism and health issues. Nothing conclusive. I cannot say that I've done extensive research on it, but I do have a pretty strong pattern-oriented mind that pulls pieces of information together. And there are some things that I don't know. I see some patterns, and I'd like to know more, frankly, and I'd love to know what other people know. Someday I'll probably try and dig in more, see what I can find. But yeah, so, gosh, so many people on the autism spectrum. I think everybody, right? Pretty much all of us have some pretty intense health issues. Seems like sometimes they are not as bad. I mean, they're there, but like a little more tolerable, and then maybe something can set it off in adulthood, and it gets really bad. I've seen that. I've had that happen myself. Just a myriad of unusual health issues. You know, one aspect that is really common. I don't even think it's common. I think it's a given, right? Isn't it a given that people on the autism spectrum have some kind of collagen defect? I mean, you can call it hypermobility, which is a really, really bad way of explaining it, because it sounds like, oh, you're just flexible, which is not what it is, because collagen is in the whole body. It's in all your organs and everything. So it's, and you know, even if it were just, oh, you're really, really flexible, being too flexible is not good for the body. It's not. You need to be able to hold the ribs and bones and everything in place. One of the big issues we have is neck issues. Most of us have like a straight neck or reverse curve or subluxations and stuff, and that's because the ligaments are not strong enough. For people with really severe collagen defects, which is the Ehlers-Danlos syndrome, you know, they can actually have the base, not the, well, I guess it's the top of their spine, I don't know, the base of their head, like, but the top of their cervix goes into, their cervical spine goes into their skulls. So, you know, it kind of makes me mad, to say the least. Trying to temper my words here a little bit. When I saw a doctor, probably, I don't even know how long it's been, 8 years ago or so, some so-called specialist in fibromyalgia, because I have fibromyalgia. And he said, he took x-rays of my neck and stuff, or he looked at the x-rays I had. And he's like, gosh, I see that so many people with fibromyalgia have, you know, that military neck, which is what they call it. And I'm like, well, yeah, okay. I didn't know that, but I'm like, why wouldn't you look into that? Why wouldn't you at least be curious? And this doctor was just, you know, some fancy schmancy doctor who I waited, you know, 2.5 hours in the waiting room to talk to him for like 10 minutes and him throw me 5 prescriptions, which I threw in the garbage, basically. He was like, well, sure, if you want to get massage, that'd be great. Like, useless. And I don't understand how a doctor cannot have some curiosity. They can see a pattern. They hear, oh, all of my fibro patients have a military neck. There's a connection. There's also a connection between fibromyalgia and autism. A lot of people with autism have fibromyalgia. And not all, but it's, you know, it's not uncommon. So, yeah, there's something there, and it makes me wonder if this innate collagen defect is the source of everything. Now, you know, one manifestation of having defective collagen is that your GI tract, I guess tract is the right word, tract is really lax, it's not strong, and you do not have good motility. So you can get really prone to infections and things because, like, you think waste is not moving itself out. So if you get toxicity in there, if you're not moving the unhealthy bacteria out, you're going to get mold and fungus and parasites and bacteria, unhealthy bacteria. And that's going to damage your intestines. And your intestines are so fundamental to everything in your whole body. You know, it affects your ability to get serotonin. And again, I don't know the science behind it. Like, I just know it, and I can't say all the fancy schmancy words, but I know from, like, talking to people and reading and all this stuff that I've done. So, yeah, so that directly affects depression. So it's not like, oh, somebody's just feeling sorry for themselves. No, like, clinical depression, okay? You know, I mean, there's also ear infections. And, you know, if you think about it, your ear, I'm twiddling with this hair tie. I just did another video and I saw that, like, it kept popping up, and I'm wondering if people think, I don't know what this is, but I don't know, I'm just fiddling with it. So anyway, my apologies if it's a little distracting. So, anyway, so yeah, ear infections. Think about where your ear is. It's right next to your brain. And first of all, why are we having ear infections? Weak immunity. And then, is it possible these infections are affecting the brain? It would make sense to me. But I have to think that there's something about this collagen defect that causes a brain to develop differently. Yeah, right? You know, I think that there's really, really pretty clear evidence that people are born autistic. But there does seem to be triggers that bring it out, maybe, whether the person is really young or they're older, or things that exacerbate it. There is a whole brand of medicine around epigenetics, which is really confusing. I had taken a huge piece of paper and I, like, literally took all the information and studied it for, like, a few days and, like, wrote out a huge diagram to try and understand, like, the methylation process, you know, which is, I guess, for lack of a better way of explaining it, converting biological materials into a form that the body can use. Is that right? Sorry if I'm not sounding very intelligent. I actually know more than I sound. But yeah, there's, like, a whole methylation cycle, and, you know, what happens is it's almost like there's different connections in the circles, and if there's a break in this whole cycle, then it's like anything, the cycle tries to compensate, and it finds some other way, you know, it's like almost like a heart bypass surgery, but it's never really fully operative, you know. So, and SAMe, which is one of the things that affects mood and depression, is part of the methylation cycle, so there's that. Yeah, I don't know. I feel like you guys are probably going to think I have no idea what I'm talking about, but I know that I actually do. It's just I haven't really, like, laid it all out and made it sound pretty. But I guess the bottom line is I want people to just start thinking about the quote-unquote health aspects of autism and what are the connections that we all have. And I don't know. I have some other thoughts, but I think I'm going to save those for another video. Yeah, I guess that's all I got. Thanks. Hey there, I've got some follow-up thoughts from the video I just recorded about health issues, and I have no idea if anyone else has this. I'm kind of guessing they probably do. But adrenal fatigue? Anyone? Anyone? High cortisol levels? Anything like that? You know, I personally think that the constant stress of trying to make sense of sensory information really taxes the adrenals. And, you know, adrenal fatigue can happen from emotional trauma as well, which a lot of us are not strangers to. But I kind of think that that's partly what's going on, is that just the constant physical stress in your brain of living and trying to make sense of the world, and that really taxes you. And also, oh God, and then there's the whole insomnia piece, and I'm not quite sure where that fits in the puzzle. If that's, you know, is that a hormonal issue? Like, what came first? Like, they're all intertwined, and I'm not really sure. I'm not really sure, honestly, but it's like a vicious cycle that feeds off of it, you know. We can have that adrenal fatigue. That might also cause us to want to actually stress our adrenals. It's a weird dynamic that, you know, I think that there could be a tendency to want to adrenalize, and there's different ways of doing that. It can be through reckless activity, maintaining a really stressful life, overwork, pressure, starvation, you know, anorexia. That actually increases adrenaline levels. So it's just this, it's a weird dynamic that it's like our adrenals are fatigued, but yet what we end up wanting to do is like keep using them, and I don't know what that's about, but yeah, and I think the adrenal fatigue is coming from the sensory overload. And I'm sure it is not helped by so much of the emotional problems we have dealing with being undiagnosed on the spectrum or diagnosed on the spectrum. I mean, that's that stress, sort of the societal stress of trying to cope. And if we had parents who are undiagnosed Aspies, they were having the same challenges we were, you know. And maybe they were using substances to cope, and then you're dealing with a, you know, parent with addiction or something who can be, you know, abusive on various levels. So you've got the trauma, just, it's like all layered together. Whew, it's complicated. And then there's like the whole other thing about, from what I understand, the limbic system, which is your fight or flight system, basically, your protective system, is very closely wired with your sensory part of your brain. So for people with Asperger's, that we can have a connection between getting sensory information and it triggering that limbic system. You know, the limbic system is useful if you have a legitimate threat, if someone's trying to kill you. You know, you need like that adrenaline spike. You need to have that kind of either fight or flight reaction. Either some way, shape, or form, you're going to survive. It's our survival instinct. But what happens, I believe, is that there's some miswiring there. And so we could, it's like with PTSD, you know, somebody has a trauma and there's wiring in the brain that we would hear that loud noise again, and it triggers the limbic system to panic. So with us, you know, it can be touch or sound or, I don't know, basically any sense. It just depends on the person. So yeah, I mean, I think that the limbic system is a huge part of it, and I wish people could understand that if somebody's reacting, it's like not their fault. It's not like that they're just out of control. It's just the wiring in the brain. And I know I personally work so hard on not letting that reaction overwhelm me and come out on other people. People have no idea how hard I work on that. Or, and trying to stay calm. And I have some other tools I've been using to try and calm the limbic system. And the one thing I forgot to mention, this is getting really long, but, with the hypermobility or the collagen defect, we would have really loose joints. And so it makes it harder to know where you are in space, okay, when that happens. Proprioception causes poor proprioception, I believe, right? So I believe there's a connection between that and dissociation. How's that for making things even more complicated, right? And I think dissociation can also be a tool that people can use or do use when faced with overwhelming sensory information. But I think that lack of proprioception is a huge part of it. And so one of the things I've been doing that's been helping me a lot is, like, before I go to bed, I kind of I lean forward with my hands, like my arms straight out, okay, and my hands on the bed, and I just lean, almost like a push-up, but just on the bed. And then I kind of lean left and right, putting a little more weight on each hand, just to give that joint compression, like in my elbows and shoulders. And then the other thing I do is to get it more in my lower body. I'm on the bed, I have my back on the bed, and my legs are bent, and my feet are on the wall. Does that make sense? So it's like I'm in kind of this shape, like here's my back, and then here's my thighs, and then my calves, and my feet are here against the wall. And then I press my feet against the wall, and I kind of do the same thing. I go left, right, so it's like more on each side. I'm telling you guys, I literally feel like this anxiety in my chest just dissipate. I don't know, I just discovered this, and I don't know, I'm like so excited about it because it really, really helps. And I think that's that getting that joint compression. When I was doing Pilates, I felt really good. I had to go super, super slow and find a really amazing teacher who was willing to go that slow with me, because my body would just flare up with like so many little things. But a lot of Pilates, you get some really good joint compression, like you're sort of doing kind of like what I just described against the wall, but on the machine, the reformer, I think it's called. So, yeah, and I've been doing another set of exercises that I got from a therapist that actually helps with the GI motility. So I was talking about that and how with a collagen defect, the GI does not move well. So that's been like amazing. And then the other thing I've been doing is I kind of put together a lot of different things I've learned over the years. Like it all just kind of started to make sense. And I don't know if anyone has sort of a compressed pelvis. I think that's also part of the collagen defect. What I've been doing is certain exercise that just kind of like, like if here are my legs, it's like kind of just spreads like the pelvis, it like makes it wider. It's amazing. It's amazing. I feel so much better. And not just in my lower body, but it affects my brain too. And if you know anything about cranial sacral fluid, I think what's happening is that the compression at the sacrum, because everything's kind of locked in and torqued and stuff, when you kind of open it up, the cranial sacral fluid flows. And I think that's what's happening. That's what it feels like to me. It's like, oh my God, I'm getting that flow or something. So between these like few things I'm doing, and I'm doing a lot of different things. I mean, stuff with diet and all that too, but these are really, really making a difference. So anyway, long video. Oh, and you know, it's funny, I watched the video, I just recorded the first half of this, and you know, I think one of the reasons I've been having trouble kind of articulating this and feeling sensitive about how I'm communicating it and am I sounding intelligent is like I have it all worked out in my brain. Like I do. But, you know, I do not think in words. That's like my third level. You know, it's like patterns first, images, and then words. And it's like I have it all there, but I can't put the right words to it. So it's an ongoing challenge I have that, you know, I live with, because it's like I really, really have something figured out and I am intelligent, but it's just, how do you take something that doesn't really have words and sort of has images and put words to it? I mean, I could do it if I wanted to spend like 4 days laying something out for you guys, but you know, this is just my side job, okay? And it's not even a job. I'm just doing it to help people. So, you know, if I were paid to do it, I could spend a ton of time pulling it all together in a way that makes sense. So with that being what it is, you know, I guess you'll just get some of my sort of random thoughts. And like I said, these are really just to kind of throw them out there, and also maybe some other people know more, you know, or have something that kind of pulls it together in a really nice way, which I just don't really have time to do. So anyway, that's it.